1 in 10 Americans has diabetes and a third don't even know it. 1 in 3 adults have prediabetes and over 80% have no idea. What I'm about to show you might be the wake-up call you didn't know you needed. Hi, I'm Jared. As an intensive care registered nurse with over 15 years of experience, I've witnessed thousands of patients suffer needlessly due to complications from diabetes. I'm also a diabetic myself. In this video, I'm going to share the top 5 most common diabetes symptoms that people easily miss. These are subtle symptoms that can dramatically impact your health if you ignore them. I'm also going to give you practical steps to take if you notice any of them. And if you're serious about lowering your risk or reversing diabetes naturally, without any medications, I have a free resource that I'll link in the description. This resource outlines the 6 steps I personally took to take control of and even reverse my own diabetes. It has the exact steps that thousands of people have used to improve blood sugar, reduce or even quit medications, and reclaim their energy while living normal lives. Now, for many people, the positive changes started by recognizing the early warning signs that some people overlook. The first one is the most visible and the most ignored, and it shows up on your skin. Skin tags are little bits of skin that hang off your neck, maybe under your arms. On the path to diabetes, many people notice more and more of these popping up. When I first noticed them on myself, I didn't think much of it until one of them started to get bigger and more annoying. I did a Google search and read that it was just a normal part of getting older, or maybe my clothes were rubbing up against my skin. After digging a little deeper, I learned that my body could be trying to tell me something about what was happening on the inside. I learned that these changes can happen when we become resistant to insulin, which triggers the unusual skin growths, and that skin changes are one of the earliest visual signs of insulin resistance, which is the first stop on the path to diabetes. Another common sign that is easy to ignore or credit to another health issue is frequent infections. Things like recurring UTIs, stubborn skin infections, nail fungus, or gums that always seem inflamed no matter how great your dental hygiene is. During the year before I was formally diagnosed with diabetes, my gums kept bleeding, no matter how well I took care of my mouth. I had to go in every 3 months for cleaning instead of the normal 6 months between visits. Even with all that, my dental hygienist kept accusing me of not brushing my teeth, and that was a little awkward and embarrassing. But it never occurred to me that the gum infection was connected to something happening with my blood sugar. Once I realized there was a problem with my blood sugar levels, and I addressed it, the mouth problem stopped almost immediately, and I had a much better relationship with my new dental hygienist. When blood sugar levels are too high, your immune system is weakened and it loses some of its ability to fight off germs. The excess sugar in your tissues also creates the perfect breeding ground for bacteria and fungus to thrive. Many people will experience the early warning sign of blurry vision, and most will write off as something normal, such as aging. They may struggle to focus on their phone screen, or things may look a bit fuzzy around the edges, or they may have trouble around bright lights at night. Now, when this first happened to me, I blamed it on being tired or staring at my computer too long during my hospital shifts. Eventually, I broke down and went to the eye doctor, but the weird thing is that the vision changes would come and go. When blood sugar levels fluctuate, it changes the fluid levels in your eye lenses and makes it difficult to focus properly. When sugar levels go too high, the fluid gets pulled into the lens, which changes its shape and affects how light passes through. Another symptom people normally don't connect to high blood sugar is persistent, unexplained itching. Not a normal itch from dry skin or an allergy, but one without a clear cause. Many people will experience this in the lower legs. For me, it was an unreachable section of my back, and I was constantly trying to find a way to scratch it without drawing attention. Now, most people never mentioned if they noticed it, but a few couldn't help but chime in. Once somebody I barely knew asked if I needed my back scratched. No, thank you. Well, the itching drove me crazy. I tried different lotions. I was offered endless suggestions from laundry detergents to advice not to take hot showers. Nothing seemed to help. Elevated blood sugar damages tiny blood vessels and nerve fibers in the skin. The combination of poor circulation and nerve irritation creates an itch that no amount of scratching will help. Another symptom can be hearing loss or ringing in the ears. Most people think of these changes are related to aging or exposure to loud noise, but very few people have ever heard that there's a connection between hearing loss and high blood sugar. I remember noticing that I was getting on my own nerves saying, huh? Eventually, the ringing in the ears became more frequent and pronounced. Now, I was in my late 30s at the time and assumed it was related to my years around loud noises as an infantry soldier. High blood sugar damages the small blood vessels and nerves in the inner ear and blocks the steady blood flow and nerve connections that make hearing possible. Every person and their symptoms are unique, but the solution to each of them is the same. Get tested for diabetes and work with your healthcare team and your health coach to treat the cause. If you've noticed any of these symptoms, you probably want to take action now to potentially stop any further damage. That's why I created 6 steps to reverse diabetes naturally. It's a guide that gives you safe and simple steps that you can take right now to start learning how you can improve your health. You don't have to wait for another doctor's appointment to start learning how to make these powerful changes. Your journey to better health can begin right now. By catching and addressing these warning signs early and getting tested now, you may avoid a full-blown diabetes diagnosis and further damage to your body. All you have to do is listen to your body, what it's trying to say, write it down. Talk to your healthcare team about it, and then take action. I've been where many of you are right now. I noticed the changes, but didn't know what my body was trying to tell me. For years, I've been on the other side as a nurse, seeing patients who could have done something before it was too late. Thinking about diabetes can be scary, but catching it early or acting before things get worse can help you avoid most, if not all, of the complications. Small, consistent changes can stop the damage or even reverse it. You don't have to wait. You can start learning what to do right now. That's why I created the free guide, 6 Steps to Reverse Diabetes Naturally. It's the same process I used for myself and the same one I use to coach my clients while under the care of their provider. Whether you've noticed these symptoms or you already have a diagnosis, these steps can help you take control of your health and stop the damage. So click the link below, grab the guide, talk to your doctor, and let's take the next steps together.